So thank you, Saida, for that. At this time, I'll call on the Director of the Research, Education, and Training Corps, Dr. Michael H. Joseph.
Good morning, everyone. It's such a pleasure to be at this conference today. I would like to highlight two endeavors of the Brooklyn Health Disparity Center that truly speaks to this notion of community engagement. And the first, we've got a glimpse of it with the Barbershop Talk with Brothers project. I want to delve a little bit more into that. So this is an NIH-funded project that is testing the effectiveness of an HIV/AIDS risk reduction intervention specifically for Black heterosexual men. Why focus on Black heterosexual men? Well, if you take a look at the research literature specifically as it pertains to African Americans, we know that there's been a lot of effective interventions targeting injecting drug users, a lot of effective interventions targeting men who have sex with men, and there's a lot of interventions targeting heterosexual Black women and their high-risk sexual behaviors. But significantly less is known about Black men's heterosexual risk behaviors. And there's a deficit in the number and the quality of prevention programs that are targeting these men in particular. So researchers at SUNY Downstate School of Public Health, the principal investigator, my dear colleague Tracy Wilson, we partnered with the Arthur Ashe Institute for Urban Health. And as you guys know, Arthur Ashe Institute has a long-standing history of health promotion and disease prevention, success in these areas, specifically in non-traditional venues, the barbershops, the beauty salons, tattoo parlors, faith-based settings. So specifically our project, the Barbershop Project, the intent is to build upon the success that Arthur Ashe has had in developing, implementing, and evaluating health promotion projects in the barbershop in particular. So we utilize the barbershop as a method of recruiting Black men into our intervention project. And we've developed a prevention program that specifically empowers barbers to deliver effective HIV risk reduction messages to the customers, so that in turn, the customers can build their own confidence, their motivation and skills needed to reduce their own high-risk sexual behaviors, but also, and more importantly, act as health advocates for persons in their sexual and social networks within their community. And so with respect to community engagement, from the very beginning, we felt that it was highly critical that our approach to addressing HIV disparities in heterosexual Black men, that it needed to be informed by community input. So to help ensure both ongoing and high-level community input and involvement, and that our program is consistent with the values and priorities of the target population our intervention is designed to impact, we developed a community advisory board that reflects the target population. Men who work and live in the central Brooklyn neighborhoods. We have a medical doctor here at SUNY Downstate. I don't need to disguise who he is. Dr. Gerald Dees, who has about 40 plus years of health promotion and disease prevention in communities. We have faith-based leaders. We have barbers. We have stylists. So each of these CAB members were very, very important members of the team, and they helped us with the formative work that we first conducted, getting a sense of what are those individual and group level risk factors that are putting men at risk for HIV. They helped us to discuss methods for recruiting and retaining men in the project, developed ideas about how should we approach and conduct HIV prevention in barbershops. So this project is really grounded in principles of community health empowerment, and we're very, very pleased with this HIV prevention program, Barbershop Talk with Brothers. The second endeavor I want to talk about, you've heard it, it's the Underrepresented Minorities Training Program. It's a research traineeship that I direct as part of the Education and Training Core here at the Brooklyn Health Disparity Center. So the traineeship experience encompasses didactic sessions focused on developing research skills, but more importantly, it involves field experience that our undergraduates and graduates have, and it allows them to engage in community-engaged research projects to further enhance their research skills. So the undergraduates we recruit primarily through the Health Science Academy. So these are students who participated way back when they were high school students in the academy. They're now in college. And the graduate students thus far have been recruited from our School of Public Health. So a key component of the traineeship is the opportunity that students have to work closely with one of our Brooklyn Health Disparity Center's community partners. And there they engage in a tailored, disparities-related service learning project. And they also have a lot of time with me. They participate in weekly seminars, so I teach them, biostatistics, I teach them SPSS, I teach them epidemiology, but they're also exposed to community-based participatory research methods. So let me just highlight 3 projects that our undergraduates thus far have produced, or are working on. One project, so we heard from Saida, and so one of our undergraduates worked closely with diaspora, specifically LaRonda, and to conduct a community assessment of resources in a low-income neighborhood in Brownsville. So they basically did a walk along a prominent street in one of those Brownsville neighborhoods to identify resources that are available to meet the needs of community residents. So this work has been featured as part of our SUNY Downstate Annual Research Day, and also an abstract has been submitted to the American Public Health Association, and we're hoping that it gets accepted to that venue. Another project, one of our students worked closely with the Brooklyn Perinatal Network, and that student did 2 projects with Brooklyn Perinatal Network. The first is an evaluation of unhealthy lifestyle behaviors among students attending a high school located in the East New York section of Brooklyn. So this particular student took some questions from the 2010 National Youth and Physical Activity and Nutrition Survey and adapted it to survey students at this high school about their daily intake of sugar-sweetened beverages, fruit and vegetable intake, as well as how often do they participate in physical activity. The other project, in collaboration with the Brooklyn Perinatal Network, the student did a project titled Promoting Preconception Health by Recruiting and Training High School Students. And this whole notion of preconception health is if we can target women before they're pregnant and have them engage in healthy lifestyle behaviors, they'll have better reproductive outcomes. So the Office of Minority Health has this preconception peer educators program where they recruit and they train college level students on how to be peer educators to other folks in that age group. But Brooklyn Perinatal Network wanted to see if they could adapt that curriculum and target, instead of college level, high school students. So they went to a high school located in the Brownsville section of Brooklyn, and it was a wonderful project where they trained 7 high school students on how to be a preconception peer education leader. So, and I always tell my students as I train them, it's wonderful to get the abstract, it's wonderful, to learn all this biostatistics and epidemiology, but what's more important is for them to continue working closely with the community partners to disseminate the research findings back to the community in a method that's understandable to the layperson, and also help in the design, in the development, and the implementation of whatever intervention projects that the community members as well as the students come up with. So that's it about the training program, and I hope that you guys enjoy the rest of the conference.